I've been a pelvic floor physical therapist I've been specialized for 15 years. I've been a PT for 25 years. There is a whole muscle group deep in our pelvis that no one is addressing. We were never taught in grad school. We're not taught in clinical rotations. And this is the missing piece. After I gave birth to my daughter, I needed pelvic health therapy. So I had someone come to my house, and that was life-changing. And I changed my business model after that. So now I have a practice in Greenwich that focuses just on home visits for pelvic health. My mission now is to get as much information out there, and we'll breeze over a lot of different topics tonight. And if you even take one little snippet that either helps you, helps a family member, helps a friend, can talk about it, that's great. There are so many women that are suffering in silence and that feel that their bodies have betrayed them, or that they are, a failure as we're getting older and sex isn't comfortable, or whatever it is that's happening. And so it is, urinary incontinence for a while was one of the 5 indicators of postpartum depression. So the way that I start all of my new patient appointments is with an anatomy lesson. And that's what we're going to do here. Your pelvis. Entire bottom is muscle. It holds contents of our internal organs, baby, and fluid when we're pregnant. Female pelvis has 3 openings. One for our urethra, one for our vaginal opening, and one for our anus. Those can be impacted. The muscle runs from your pubic bone, which is a little piece of cartilage actually, all the way back to your tailbone. That contracting and relaxing controls these openings. You can have pelvic floor dysfunction having a C-section. It does not have to be. That is major surgery, a lot of scar tissue. What happens after delivery, either way, it either says, those muscles say, holy smokes, what just happened? I'm never contracting again. And that's when we get the low tone issues. We get, the urinary leakage, a little stool leakage, prolapse. When we have higher tone muscles, that's when it says, holy smokes, I'm never letting go. That's when we have pelvic pain and a lot of other issues along with that. Higher tone pelvic floor is when, the muscle is holding onto tension and it never really lets go. So it just sits there. Your diaphragm really isn't helping and moving things along. We can have pelvic pain, just that muscle tension. We think about our neck muscles and how much that is uncomfortable when the muscles hurt or are tight. Our pelvic floor is the same way. It holds that tension. So we need to release those muscles. It's often called vaginismus, just that general tightening of the pelvic floor. And we can use yoga stretches, diaphragmatic breathing to help loosen that. But we can also use dilators. They look like vibrators that don't do anything. If you have vaginal intercourse and it's painful, your brain remembers that. And so it says the next time your partner brushes your buns in the kitchen, you're like, oh my gosh, I'm gonna need to have sex later. And then your body tenses up. There's no way you're gonna set yourself up for a successful, comfortable, positive sexual experience if your body is always tensing up. You can also experience urinary incontinence even with a higher tone pelvic floor. So if you have that tension, it's really strong in that one range. If you take it out a little bit, it's not strong. If you move it a little bit, it's not strong. If your pelvic floor is too tight and too strong, it's gonna be very difficult to release that stool. So it really is very important when we're thinking about how our anatomy affects our functional ability.